So this presentation is going to be over autism spectrum disorder, which was formerly known as just autism disorder, which we will kind of get into that a little bit later, but it is now considered a spectrum disorder. So essentially, what is autism spectrum disorder? Autism spectrum disorder is defined by the National Institute of Mental Health as a developmental disorder that affects communication and behavior, which is a pretty broad definition. This disorder, though it can be diagnosed at any age, is still considered developmental, as symptoms for the disorder generally appear around the first years of life. They just may have gone undiagnosed or unnoticed. The spectrum disorder is kind of self-explanatory in the sense that there's a wide range of symptoms and their severity depends on person to person, and so a person can be, anywhere on the spectrum depending on how strong their symptoms are and how strong it affects their life and their daily ability to function. So the symptoms don't necessarily have a severity on the spectrum, it's more so how it affects them individually. General symptoms are difficulty with communication, difficulty with social interaction. Those two are the most seen in representation in like the media and things like that. An example of that being on the Sesame Street episode where they went over autism spectrum disorder and tried to put it in a way that children could understand. That character had difficulty communicating with the other characters on Sesame Street and kind of had issues with the social interaction, and so they kind of went over how that character was not ignoring them, but that's just how they played per se, or that was just kind of how they functioned, and it wasn't to anger the other characters or the children they were trying to play with. They also have very restricted interests. Generally, we see this in other representations in the media, such as Big Bang Theory. It's been noted that Sheldon is somewhere on the spectrum because he has very limited interest and he knows a lot about them and he will discuss them at great lengths, whether or not it's socially acceptable. They have repetitive and habitual behaviors. This is kind of where they have a routine and they don't stray from that routine. It can be a huge source of stress when that routine is altered or if they have to abandon it for any reason, especially in young children. Symptoms can negatively affect a person's ability to function in school or work, which we kind of talked about earlier. When looking at autism, especially in children, it's generally noticed at school or on sports teams or by teachers first, because they'll see how they interact with other children. So that's generally where if parents don't notice it at a young age, especially parents with only one child who don't have other children to compare their behavior to, school is kind of really where you're going to start seeing those symptoms come out when they're in a immense social setting. And so generally you see special needs teachers evaluating these students and then reporting back to parents when it comes to their ability to function. The major symptoms kind of have subsets. So this can manifest in little eye contact, sensitivity to light and sound, especially rapid change in light and sound. With the extensive knowledge of limited subjects that comes with excelling in certain things, people will excel in math. People who are on the spectrum will generally excel either in like math-based subjects or art-based subjects such as music or drawing. Some of that limited focus and hyperactivity in certain subjects really manifest in that way. They'll generally have an unusual sounding voice, especially as they get older. It'll be more sing-song or robot-like than what we would generally consider to be normal for people of their age. This is the part that doesn't really show up when they're children because children have, ever-changing voices. This is more manifesting in adults. Unable to read social cues or predict other people's actions, and so this kind of comes with the inability to function socially. They can't read social cues, or if they receive them, they don't process them. They can't predict other people's actions, and so this can be very frustrating for them because what they would do or what they think they're going to do is not correct, or they just don't have the ability to predict something other than their own actions. They have low theory of mind, so they have the inability to understand that other people think and have lives and feelings outside of their own. And this is kind of where the developmental part comes in. They don't ever really develop theory of mind, which they can be taught somewhat through cognitive therapy, but generally they don't really develop a strong sense of that, which is why some older children are diagnosed later in life than when they're younger, just because they notice that they don't have the ability to consider other people. They will generally have facial expressions or gestures that don't fit what they're saying, so they will look incredibly angry or upset when they're saying something happy, and vice versa. This can also be adverse reactions to what other people are saying, so they'll be receiving great news, something that would make them generally happy, but they'll react very negatively. It's a disconnect between what they're outwardly displaying and then what they're taking in information-wise, so it can be another thing that feeds into their inability to function socially or academically or what have you. What causes autism spectrum disorder? There's no exact cause that's known for autism spectrum disorder. The general consensus is that it is a kind of an amalgamation of several different factors, the largest being environment and genetics. So you can have a genetic predisposition for autism spectrum disorder, and then your environment can exacerbate that, or you could have this disorder and not ever really know because you're in an environment that isn't conducive for those symptoms to be harmful to you. Contrary to what is apparently popular belief, vaccines do not cause autism. We see kind of the rise of the anti-vax movement because of autism, and we're going to get into why that is the case here in just a minute, but there's been no proof at all that vaccine, specifically the MMR vaccine, causes autism. Some actual risk factors for autism spectrum disorder can be having older parents. So as the mother's age increases at the time of conception and birth, the likelihood of having autism spectrum disorder does go up. There's not a whole lot of research as to what the direct link to that is, but it is seen as having some pretty strong correlation. Having siblings with autism spectrum disorder. Having siblings can kind of give an indication that you might be at risk for that. You may not exhibit any of those symptoms, but it is kind of an indication that if one child does have it, it is likely that the other child will as well. There's a low birth weight, so if you're born and you have a lower weight than what is normal for your size or your age, so if you're born prematurely, this is a little bit different, but if you're born and you have a low birth weight, they are concerned about autism spectrum disorder. This comes in with the genetics because they're unsure as to if it's genetically causing a low birth weight or, the mother's health. So there's a lot of factors that go into that, but that is something they kind of watch for. If you have other genetic conditions such as Down syndrome or Rett syndrome, this can be a precursor for autism, or they can be very comorbid. They are seen often together, usually starting with Down syndrome or Rett syndrome. But having autism spectrum disorder is not a precursor towards Down syndrome or Rett syndrome. When diagnosing ASD, it's generally done in the first 2 years of life, which is kind of where you see the correlation, or some people see a correlation with vaccines causing autism because of the age you get the MMR vaccine. All parents are encouraged to have their children tested at many milestone ages, including, when they come in for their checkups, their 6 months, their 1 year, their 1.5 year checkups, they're encouraged to be screened for autism spectrum disorder, especially if they exhibit risk factors. Diagnosis is usually 2 parts. There's the screening and then the genetic risk, so they evaluate the child for the genetic risk, their environmental risk, and what have you, and then the additional testing, which usually includes, cognitive testing, behavioral testing, which usually comes a little bit later. You can't really do that in infancy unless you can kind of determine the sight and sound sensitivity or the inability to respond to being called when they call their name. Testing for ASD in adults is a little bit more difficult because a lot of these symptoms can mirror other mental health disorders, especially in older adults now where their medical history may or may not be present. So it's a little more difficult to do, which is why, they really, really push the screening for the first 2 years of life. Previously, people would have been diagnosed with Asperger's syndrome or pervasive developmental disorder not otherwise specified. These changed when the DSM-5 came out in 2013. As I said earlier, autism spectrum disorder used to be called autism disorder. This is now autism spectrum, as they've determined that there is a spectrum. It is not a single set of symptoms with a single set of severity. So these are other names that some people still use, but generally what is accepted now is autism spectrum disorder. For treatment for the disorder, it occurs out of 1 out of every 59 children. You don't really cure this disorder. You don't treat the disorder itself. You treat the symptoms of the disorder. So many of the symptoms are treated with medication. If they're the more mood-centric, like irritability, depression, anxiety, things like that, they're treated traditionally with medication. However, the behavioral symptoms, depending on how severe they are, they'll be treated with like family training on how to interact with the person who has ASD, or if the person is old enough or able to understand, they will be educated and they will learn how to navigate the world with their disorder. There's generally a lot of special education that goes on in school, and then there's a lot of support groups and then medical attention that's seen after that person leaves school. But depending on when they're diagnosed and how severe these symptoms are to that person, their treatment varies, but a lot of it's just education and learning how to navigate with that disorder. But it's not debilitating. Usually it's not seen as something that needs to be cured per se. It's just something that you have to learn to navigate with, such as depression and anxiety. That's what kind of the movements are saying now, is it doesn't need to be cured. It's not a cure that we need. It's learning how to navigate and treat it like we do depression and anxiety and other more common mood disorders. So where the research is going for this field, it's really just going away from the misinformation. Dr. Andrew Wakefield, who's not a doctor anymore, thankfully, popularized a lot of misinformation linking the MMR vaccine to autism. He falsified data in the studies that he did, attempting to, not just link correlation but causation, saying that the MMR vaccine and the mercury that was in it was causing autism. A lot of his evidence was based on the fact that you get these vaccinations at the same time that you can diagnose autism. Correlation does not equal causation, but the damage was kind of already done. His license was revoked and his studies were pulled, and he was no longer allowed to be published. But he continues to speak about his studies to this day, and a lot of people don't look at him, skeptically. They take what he's saying as truth. So essentially, all the real research that needs to be done about this disorder is being put on hold in an attempt to kind of clean up the mess that he started. And so now we see a rise in parents not vaccinating their children because of this person and what they've popularized. And so, this field is trying to pioneer the resurgence of popularity in vaccines because of, herd immunity. We're having diseases that are coming back that were supposedly extinct and such like that. So research is kind of stalled for this field. It's more so just trying to prove what we've already known, that vaccines don't cause autism and that autism isn't a disorder that you should choose having a child that could potentially die over having a child that could be autistic. So unfortunately, that's where this field is going. And these are the two major sources that I got this information from. So thank you for listening to me talk about autism spectrum disorder.